at imminent risk and in need of services to prevent entry into state custody, or who are in state custody pending family reunification or other permanent placement. DCS's mission is to provide high-quality prevention and support services to children and families that promote safety, permanency, and well-being. And DCS's vision is to create a safe and healthy environment for children where they can live with supportive families and engaged communities. Our goal was to determine what changes and improvements DCS can make to better promote their mission and vision. As part of our audit, we followed up on the prior audit reports our office issued in December 2020. The prior report contained 10 findings and 9 observations. In our current audit, we have 13 findings, which consist of 6 new findings, 5 repeated findings from the prior audit, and 2 observations from the prior audit that were elevated to findings. We also have 1 observation, which was a finding in the prior audit that has been partially corrected, and management resolved the remaining 4 prior audit findings. Before we present our findings, we thought this committee should hear our key takeaway from the audit. Based on our work, which included review of case files and interviews with DCS staff, DCS is struggling to provide support services to Tennessee's most vulnerable children and youth. Case manager turnover and employee vacancies at DCS have reached crisis levels, while the number of children going into DCS custody continues to rise. This crisis is negatively impacting the department's operations. I will turn it over to my colleague to discuss DCS's turnover and challenges to fill vacancies.
My name is Lindsay Satterman, and I'm a Legislative Audit Manager with the Comptroller of the Treasury. Case manager turnover and caseloads are covered in Finding 2 and Finding 3. We will present these 2 findings together. Case managers account for 71% of DCS's entire number of budgeted positions. Case managers are the backbone of DCS, and they provide fundamental services to a child who is either in foster care or juvenile justice, and they investigate allegations of child abuse and neglect. Without case managers, DCS cannot meet its mission to serve the children of Tennessee. Finding 2 is about case manager turnover and is on page 14 of the report. We found management's inability to fill vacant case manager positions and their failure to adequately address increasing turnover has created a staffing crisis and resulted in overworked and exhausted case managers who are serving children in a chaotic environment. Based on our analysis, we found that as of July 2022, 22% of all case manager positions across the state were vacant. We also analyzed DCS's case manager turnover rates. And for fiscal year 2022, we found that turnover among DCS's case managers across the entire state was 56%, meaning that 56% of case managers left DCS in the most recent fiscal year. Next, our review of entry-level case managers for calendar year 2021 showed that 97% left DCS within their first year of employment, which shows that DCS is not retaining new recruits. We also want to point out that the Davidson County Regional Office's case manager overall turnover rate of 127% was alarmingly higher than other regions during fiscal year 2022. Case managers' turnover rate and vacancy rates vary widely among DCS's 12 regions. Details about each region can be found in Appendix 7, which is on page 109 of the report. While we found that management has taken actions to try and recruit new case managers and retain the case managers they have, we found that more work is needed. Finding 3 is about case managers' caseloads and is on page 21 of the report. We found that case managers' actual caseloads exceeded the state maximum for average caseloads, and case managers' workload does not allow them to provide the necessary attention and resources to children and families for whom they are responsible. Tennessee's caseload law requires that each of DCS's 12 regions keep the regional average caseload to 20 cases or less. However, we found that DCS has not been in compliance with the state's caseload law since April of 2021. The actual number of cases assigned to a case manager fluctuates depending on the number of case managers in a region and the number of children entering and leaving custody. In our 2020 Sunset Audit, we found that 8% of case managers had actual caseloads over 20 cases. During our review in the current audit, we found that percentage had significantly increased to 37% of case managers now having actual caseloads over 20 cases. Our review also found that around 4% of case managers now have actual caseloads over 40 cases. With such high caseloads for long periods, staff cannot provide the time and attention needed to the children and families they serve. We also noted a matter for legislative consideration where the General Assembly may wish to revise Tennessee's caseload law to use case managers' actual cases instead of average cases. Management concurred with both of these findings, and this concludes my presentation on findings 2 and 3.
Thank you very much from the auditors. And now we will go to the agency and ask you to introduce yourselves. And each time you speak, do introduce yourself for the record. And you may proceed in your response to findings 2 and 3.
Thank you, Madam Chairwoman. Good morning, Chairwoman Bowling and distinguished members of the Government Operations Joint Committee, Subcommittee on Education, Health, and General Welfare, Mrs. Stotterman and Ms. Perry. To my right and your left is my Chief of Staff, Andy Verinsky, and to my left and your right is our Audit Director, John Murphy. The Department of Children's Services appreciates the opportunity to be here today and engage in a collaborative process with the comptroller and members of the General Assembly to address the audit findings. It is important to talk about some of the lessons learned while looking to the future. Our primary service is to ensure that every child in our state has a loving, permanent home. The Department of Children's Services has its challenges that go back several years. I'm here to find answers. Some of that will be difficult, but necessary, charting a new path that is for children and processes that draw on best practices. I have found through experience that the best therapy is action. Our current system is built for the needs of children from 10 or 20 years ago. It doesn't serve well the needs of the children we serve today. The budget asks this year are about transforming a system that is equipped to deliver services to children's needs today. Change doesn't happen overnight. It happens one step at a time. We will take those steps together. At the Department of Children's Services, our responsibilities are to investigate allegations of child abuse and neglect, monitor children's health while in custody, run the state's foster care and adoption system, and oversee kids found delinquent by juvenile courts. To fulfill these responsibilities, we will evaluate our processes and, when required, design them so there is no question about how children are handled and treated in our care. But in the end, it is the people that are going to run our services. We will give our employees the tools to solve problems. We will build a team that does rigorous work, give them an agency they want to serve well, and we will reward their efforts. As we look to the future, there are specific steps that address immediate needs and longer-term actions that will place our agency and the state on a better path for positive impacts for our children. Our DCS budget requests this year address 3 main immediate challenges: hiring and retention of caseworkers, placement of children, and repeat historical audit findings. I am also passionate on prevention, targeting the 0 to 5-year-old population, allowing us to intercede with early childhood trauma and focus on drug-exposed areas of the state. And there will be more longer-term priorities. Staffing and agency capacity issues have challenged DCS for years. We have struggled with hiring and retaining staff, with the result being unusually high caseload averages. To do our job, we will need additional help, and that may include a temporary privatization of case management. This would be a strategic 2-year solution, providing time to rebuild and provide much-needed relief to overburdened case managers in our hard-hit regions. A combination of budgetary requests, internal risk management, which includes policy creation and monitoring, and supervisory oversight controls will remediate findings and set DCS on firm ground for the future. I look forward to answering your questions. Specifically for findings 2 and 3, in the problem statement in the packet that we have provided you, recruitment has increased approximately 25% from where it was 4 years ago, and the department leaders recognize retention as an area of opportunity. In reviewing the exit survey data from the Department of Human Resources, and there is unfortunately quite a bit of exit survey data that we can look at, we feel like a 3-pronged approach is appropriate. Those leaving the department cite workload overload as an area for improvement. They cite leadership and frontline supervisors as an area for improvement, and they cite pay as an issue for leaving the department. So money isn't the primary driver for leaving the department, but it is one driver. So we intend to immediately create new policy for new hires that cap caseloads in their first year at 10. This has been an internal, they're supposed to cap caseloads at 10 the first year, but it was not a hard policy. It is now a hard policy. So when they come out of training, they will receive no more than 10 cases in their first year. Provider rate increases in the budget ask will increase our network capacity for placement of children, and this should reduce case managers' sitting responsibilities, which we've all heard about in the last 2 years. Case managers sitting at nights and on the weekends with children, which is really pulling double duty. That is not what they're originally hired to do. They're originally hired to work cases, visit children, and oversee cases involving children and families. They are not hired to sit at night and on the weekends. They've been pulling double duty for 2 years, and it's too much, and it's overburdening our case managers. So the provider rate increase, we're hoping, is going to alleviate the burden of the sitting. We also increased sitter rates to $45 an hour to attract more sitters, which will reduce the number of case managers that are having to do that while we're trying to increase the provider network. We've increased security in all offices to ensure case manager safety. We have a budgetary request in FY24 of $15.8 million for increasing case manager salaries. We've posted new case manager assistant positions, which posted in November of 2022 to assist case managers with administrative tasks to relieve the burden on case managers. So they'll be able to perform administrative tasks, they can sit with children, and they can transport children. Again, relieving some of the burdens on case managers. On a regular basis, DOHR will provide retention rates by region so that we can monitor what's going on by region and in our hardest hit areas. And we can target intervention by region to address identified needs. And I think very importantly, we have also identified training as an issue for improvement within our department. And we intend to take a very aggressive approach to training as an area for improvement. We've partnered with the Casey Foundation and looked across the nation to see which child welfare agencies are doing the best job at training and retention of case managers, and immediately identified New Jersey as the best state in the nation for turnover rates. They are averaging, since 2006, between 6 and 10% turnover rate, which is outstanding, and they maintained that through the pandemic. So we're flying a team of DCS leaders to New Jersey in January of 2023 to study their training, curriculum, and content. Going to bring that back, form a working group over 90 days. We're going to implement a 6-month training curriculum in March of 2023. Right now, our training curriculum is 10 weeks. We're going to immediately move to a 6-month training curriculum, pairing also, as soon as they're finished with training, pairing a case manager with a senior case manager for some period of time, 10 to 12 weeks. And again, that first year, it's a 10-case cap for that first year. So they feel well-trained, well-supported, not overloaded, higher salary, and we feel like with that 3-pronged approach, that will be a better measure, better avenue for success. It will be a short-term pain, I think, for our agency. I briefed leadership on this last week in Cookeville. They're on board. I think this is the direction for our department. It's been successful in other states. It's proven in other states. And this is the direction that we need to go. Our goal is the reduction of case manager turnover in FY23 from 50% to the national average of 30%. So we'd like to, in that first year, see a reduction from 50% to 30%. I think that's a pretty aggressive 20% reduction. And year over year, obviously, we'd like to see that continue to reduce as we improve our training and our burdens on case management. In finding 3, caseloads, recruitment again has increased 25%. We have a budgetary request in FY24 of $11.4 million, 2-year reoccurring funds for privatizing case management for hard-hit areas. Those would include Davidson, Knox, Northeast, Shelby, Smoky, and South Central. This would hit our this would be implemented in July of 2023. I will tell you that some states have entirely privatized case management. We would never advocate for that, but we think as a 2-year solution, while we recruit, hire, and retain case managers, this is a great 2-year solution as a strategic option for us while we beef up the numbers of case managers that we have. We're also going to initiate a special response team of 6 case managers in the Office of Child Safety beginning January of 2023. These will be roaming case managers, and they will be able to deploy to hard-hit areas in order to help these hard-hit areas for 1 week at a time, 3 days at a time, help them meet with children, close cases, get their caseload averages down, and otherwise supplement in areas where we're falling behind. We're going to leverage those newly established case manager assistants to reduce case manager administrative work, and again, partner with Casely Family Programs for a strategic consultant to review case manager workflow. That will begin in June of 2023. We're going to, as far as risk mitigation, ongoing temporary reallocation of case managers and resources to understaffed regions of the state. On outputs, I'd like to draw your attention to the duplication of second shift teams in hard-hit areas of the state. This is something we deployed in the Shelby office a couple of years ago. We've had 100% retention rates on the second shift in Shelby. This is something that our staff had been asking for several years. For some families, offering the ability to work a second shift. For families with children, a lot of times that's a great benefit to have one family member working a second shift, and there's a shift differential for that. And so being able to deploy that in Davidson and Rutherford and in some of our harder hit areas, being able to utilize that second shift is a great benefit. And so we're bringing that to 3 of our harder hit areas. I welcome your questions.
Thank you very much, Commissioner Quinn. And are there any questions from the committee? Representative Dixie, you may go, Representative Dixie.
Thank you, Commissioner, for coming. Thank you for all for coming. And I understand, I want to give a preamble before this. I understand that you stepped into an impossible job. I don't think anybody in this room would really want your job at this point. But I thank you for taking on this challenge. And we've talked, and I understand the passion that you have for this and want to do a good job for this. I have a couple questions. Some I've already asked, but I just want people to understand what we have going on. A couple of things. One, you said in Davidson County there's 127% turnover rate, and you have a 90% entry-level turnover rate. Even with the implementation of this new salary of $43,992, how do you expect to keep good employees, especially in Davidson County, when you can't afford to live on basically $44,000 a year? So one, if you can, and I could ask these in a couple so we don't get lost in this.
Can I respond to that one first? Okay, that's a great question. So we've also asked for $15.8 million. $43,000, I agree with you, is not enough. And that is not the target that I am shooting for any of our case managers, not just Davidson County, but anywhere in the state. And I think if you go back and listen to my budget hearing, you will see my explanation for why I'm asking for a higher salary for our case managers. I am asking for a higher salary than that, and I'm asking for that to be implemented as quickly as possible. We have equity within our department, so they're now at 43. A year ago, I will say they were at 35. So the legislature, I'm very grateful the legislature took them to 40 as of August 1st. The market salary increase this month took them to 43. I'm asking for a higher salary than that. And again, Commissioner Williams will be waiting for me in the tall grass if I tell you what that salary is. But I'm very hopeful that is being worked on as we speak, and we can get that implemented as soon as possible. But it is higher than 43.
Right. Well, it's good to hear that we don't have to wait to the next budget year before these implementations.
I'm hoping that we can implement that before the next budget. And then the $15.8 million, should the General Assembly grant my request, would carry us through the next FY24.
And I think we have to look at this from a different point of view. It has to be a partnership that we've talked with the legislature and your department. It has to be more of a cohesive relationship, because right now it's not working at what's going on in silos. You can't do it by yourself, and we just can't keep legislating things that you can't possibly keep up with.
Yes, sir.
My second question is, you mentioned the privatization of services. Can you kind of explain to me what that would look like and what that means?
Right, we would contract with a private provider, one of our private providers, to do the private case management. So they would come in and take some of the cases and do private case management alongside our case managers in those hardest hit areas that I 95 case managers in those hardest hit areas of the state that I listed. In Davidson, Knox, Northeast, Shelby, Smoky, and South Central. Those are where the caseload averages are the highest. That's where we need to get those caseload averages down. So in Davidson, where you're talking about the really high turnover rates, that's where we need the most help. And so if we can, do some specialized response team, do a lot of privatized case management. Anytime you deploy somebody in those hard-hit areas, they just get flooded with cases. They're overwhelmed. They're overworked. We just can't keep them. And they get out of training. They get flooded. They're overwhelmed, and they quit almost immediately.
Yeah, and I understand.
I do too.
All right, if you can just indulge me just a little bit more. Well, I have more. This is such a vast thing. It's hard to keep to 3 questions. So I hope that if we can have enough time that maybe you can come back and answer a question.
And Representative Faison, there will be several more,
Dixie.
excuse me, Dixie, there will be, excuse me, there will be an ability as each issue is brought forward with the findings. So some of yours may relate more to additional findings when you could ask them as they relate to what has been discussed. But right now, as you're aptly stating, the employment of caseworkers is systemic, and that seems to be foundational to all the other findings. So I certainly understand your concern for that aspect of it right now as a priority. But proceed, if you will, with another question.
Well, I along with those lines, I'll ask one more question, then I'll reserve something to later on. How many vacancies right now do we have for case managers as a whole? Do we know what that number is?
488.
Okay. 488, and even if
That was as of last week.
all right, and then even if we have the privatization of services, we don't talk about 95, so it still leaves a pretty good gap in vacancies. Okay, thank you. Thank you, Madam Chair.
Thank you very much. And I apologize for calling you Representative Faison. Chairman Reagan, you're recognized.
Thank you, Madam Chair. I'm going to ask a couple of questions for the sake of the record and then some to satisfy my curiosity. First one, for the sake of the record, you have increased your legislative, your budgetary request through the governor's budget. Is that correct? And by how much was that?
156 million.
All right. And you've also, there was a audit fund. By the way, excuse me, I meant to open with thank you to the auditors and thank you to the department for being here. We appreciate it. Back to the question. Besides the governor's budget compensation or package, the auditors mentioned a legislative consideration. Have you approached the governor's staff about including this in the governor's legislative package?
No, sir, we have not.
Do you intend to do that?
No, sir, we do not.
And might I ask why?
Is the question, why do we not intend to ask the governor to cap caseloads at 20 per person? Is that your question?
The overall recommendation was for legislative action, all right? And so obviously any member of this committee can file a bill and run it through. However, the governor submits a legislative package in total at the beginning of the session. That legislative package is what I'm talking about. Have you included any inputs for the governor's legislative package, whether it's directly related to the number of workers we're talking about or anything else?
Not related to workers, no, sir.
Do you not see, Madam Chair? Do you not see the need for any legislative action to help you there?
The requests that we have made are related to increased salaries, privatizing some case management, provider network increases, all of which we think will directly and indirectly impact the findings of the audit. TFACs, which we've not yet talked about. We've made a number of requests through the budget that we believe will directly and indirectly impact the findings of this audit.
Thank you. Last question, Madam Chair.
You're recognized.
On these findings. I'm curious if your organization has done data gathering specifically on the demographics of your population that you are serving, and if there's any correlations that can be drawn, not just geographically, you've already mentioned those, but in terms of the characteristics that would perhaps help you to focus the work of your case managers in certain areas, not again geographic, but otherwise, to attempt to solve that problem that way. Do you have any of that?
I'm not sure I understand your question.
Well, I could ask you bluntly, how many of your cases involve demographics of children under 5, demographics of children under 10, et cetera, or how many children are single-parent family origin, how many children are subject to abuse from a parent that has come out of incarceration, et cetera?
Yes, sir. I think
Basically,
yes, sir. I think we do know.
You have that
Yes,
information?
sir. Yes, sir.
And that does not help you focus? Your case managers?
I think it helps us target prevention and services. Yes, sir. I think it helps us understand what community partners to reach out to with respect to services to put into homes, to prevent children coming into custody. I think it helps us, in some of the budget asks, there's a pretty good chunk, about $7.5 million for prevention. And that is all targeted towards the data that we've gathered around children that are subject to domestic violence, children who have parents who potentially are impaired, children who have parents or single-parent homes, and safe baby courts. And all of that prevention work is targeted towards preventing children from coming into custody. And so the data that we're gathering speaks to all of that prevention work, and it is trying to prevent children from coming into custody.
Madam Chair, I'll clarify. This will be my last question on this findings. I'll have more later. For clarification.
Proceed.
This data gathering you're doing, have you availed yourself of any of the academic institutions in our state, 11 of our college campuses, many of which have social work degree granting capability, and do research in this area? Have you asked them to do specific research for you?
Yes.
And have they responded?
Yes.
Thank you. More on that later. Thank you, Madam Chair.
Thank you, sir. And I believe it was Senator Wiley is next. You may proceed.
Thank you, Madam Chair, and to our auditors, thank you, and Commissioner and your staff, thank you. I just wanted to reminisce for a moment as I'm looking at you out there, remembering my time being in that seat myself before this legislature, before the legislature in Alabama when I served in similar roles. I heard our auditors mention that we constituted this department back in 1996. I happened to have been a much younger legislator on the House side then and was the prime sponsor of that legislation, while Senator Curtis Person, was the prime sponsor of the vision for this agency. So being able to watch it over these last, 26 years develop has been something very close to me. I think I might have the distinction still of being the only commissioner who was a named defendant in 2 states on public child welfare consent decree lawsuits. That we, as a matter of fact, were the first in Alabama to ever exit one. Tennessee followed many years later. That's really where I want to begin, because how we got there really connects to what we're trying to do right now with recruitment, retention, excessive caseloads, not only for case managers, but also for supervisors trying to supervise cases. Many supervisors being just battlefield promotions based on being short timers that happen to survive while those in front of them left because of difficulties with managing what's the hardest job in state government. And I want to say that to you publicly. I think your position is the hardest job in state government. A friend of mine, the Department of Revenue in Alabama, told me one time, he said, when I make a mistake, we issue a refund check. When you make a mistake, a child is injured or dies. So it's that serious, and I appreciate your all approach to looking at these very important assessments from our auditors and seeing how we're going to move forward. I wanted just to comment on a couple of things that you've mentioned as far as proposed remedies in these areas, and mention another that I think might be worth considering, or maybe a couple that might be worth considering as we look through remedying in these particular areas. As you go about recruiting and retaining, and we're seeing turnover, and you were presenting the data by region. When we exited our consent decree in Alabama with our federal courts, we committed to doing a couple of things that were designed to keep us sustaining the gains and building on those gains rather than what I think people feared was the inevitable regression, particularly when you remove the pressure from legislators to fund and resource positions that a consent decree can provide. So a couple of things that we committed to and developed were, first of all, regular report cards on performance outcomes that were made public on the website with certain dependent measures by county. And those were issued twice per year, so that everyone could see, and every be it region or county, sees that my data are going to be made public to the stakeholders, to our taxpayers, to see performance outcomes. It also was keyed to advisory councils or commissions within each county in that case, or could be within each region here, that could be providing that local input and support for your efforts there, which I think are important. I want to do what we can do to support you in every way right now, because the average lifespan of a commissioner in your position is 18 months across the country. This is the same story going on in every state in this nation, trying to manage these extraordinary demands on our children and families. So the report cards is an idea. If you had an interest, you could talk in Alabama or with me or others. Another had to do with what we did was commit to putting in statute caseload standards and supervisory standards, such that it put the legislators on the hook for saying, if we believe this, then we're going to be coming back annually, reviewing it and funding it. If we need more, we're going to fund more. That gave, those combination of items gave the judge a greater sense of comfort in signing off on the exit strategy that we had put forward. So those are just a couple of things. The crisis teams, or I call them crisis teams, you manage the response teams for the special response units that can provide supplemental support for our workers out there. I applaud that. That's very necessary to have some nimbleness to be able to go where the balloon's being squeezed and you're having that. I would also ask that you consider not only be it case managers, but real supervisors that can be your heavy hitters that go in and stabilize situations that will become unstable. So we need someone in senior leadership that is as nimble as your case managers might be. So just a few things for us to consider. We as a legislature might need to work with you and put caps on these statutorily. And I'm not talking about just caseload, but cases. And there's a difference between cases and caseloads. I know that you may define a case as a whole family. All of a sudden, you have a family of 6 children and you have 20 cases. You can do the math and see it gets unmanageable. So let me ask you if you have any kind of initial thoughts to those items that I've brought forward. Maybe it's something you're already contemplating, maybe it's something we're already doing and I'm unaware.
I think the idea of supervisors is a great idea because I think leadership is very important. One of the things that we're looking at in the DOHR exit interviews is specifically whether or not we have supervisory issues across the state. Leadership is one of the issues that I think is causing people to leave, unfortunately. And so if we have an area where we need to do some additional training, just because you are a great case manager doesn't mean you're going to be a great supervisor. If we don't train you to be a great mentor, a great coach, a great leader, we're failing in that area. And so there may be some areas of training that we need to do with our young leaders so that we are retaining staff and they're overworked and they're overburdened. And we need to do a better job at supporting them through training and mentoring and leadership. And so we're really digging into a lot of that exit data because it's very rich with information that we need to be doing something with. We don't need to be discarding that because it speaks volumes about what we need to do in our department in order to retain the staff that we're hiring. We're hiring a lot of people. We're just not keeping them. And so to some extent, that's on us. And we've got to learn from that. So I think that's a great suggestion. I am not opposed to capping cases per person. But I've got to look out for my successor. At some point, somebody will come in after me. And if we don't control the number of children who come into custody. And if in Davidson County, if we're fully staffed in a couple of years, from your lips to God's ears, right? If we're fully staffed in a couple of years, and in Davidson County, we've capped cases at 15, but in a couple of years, we have an influx of kids, and those caseloads go to, all the case managers are averaging, or they've all got 19 to 25 cases. What happens? Does the legislature give us more people?
I would say that it's incumbent on the legislature to respond then, to either change those statutorily, the caps, or
Right.
to fund the ones that are needed. And that's the whole point to me, is that
Right.
it puts the onus back on us, and we are the stewards of the public good, and that's what we do and why we do it. So I would say yes. And I would also just mention, as you think through the idea about some kind of public report card, very few things inspire each of us than to know we're being evaluated publicly, to perform maybe in a little bit different manner. And when we also then are being compared to our peers, it's something I think this legislature takes great pride in when we're compared favorably to peers on issues like tax burden on citizens. Well, it might have to be a comparison on retention of staff, on numbers of kids in out-of-home care, on any of the metrics that we think are most important, but I think that's something we need to think about because that's accountability.
I couldn't agree more, sir. I think transparency is very important. If we can't define the problem and state the problem, we certainly can't solve the problem.
Thank you, Madam Chair.
Thank you, sir. And you will recognize Chairman Roberts.
Thank you. When we talk about this need for new employees, obviously, if we have retention, then that takes pressure off of our need to recruit. We're seeing all these different things that impact people's ability to stay, but the one thing that I haven't heard spoken of thus far is just the emotional toll that's taken on our caseworkers and how that impacts them. We could improve pay, we could improve caseload, we could improve many things, but we still have the fact that this is such a difficult job for people and it weighs on them heavily. And obviously for someone to be a caseworker, they care deeply about these children in their care, but it just has to be exhausting. What kind of plan do we have in place that might help our caseworkers just with respect to their well-being? And I suppose they probably just need a break at times, but what's our plan to help them with their emotional well-being? So, and by the way, I would just say, I know you're not the one conducting the exit interviews, but I think that would be a great question for an exit interview is there just one thing, or is there something that would have led you to stay? Is there just one thing that we need to know about? Because we get all this wonderful data as a result of these interviews that we can then turn around and apply to our environment. But I'm not hearing anything about that, and I know that's kind of like the elephant in the room, so to speak. But could you address that for a moment, please?
Thank you, Chairman Roberts. I think that's a great question. I will say that 5% of the people that we hire don't show up. So 5% never walk through the door. And another certain percentage quit in the first week. So, but I will tell you that in the last year, there's been a concerted effort to bring in a lot of peer counseling. So we're graduating pretty substantial classes, 40, 50 at a time, who go through pretty extensive training for the ability to peer counsel. Trauma is a big concern in this job, both vicarious trauma, secondary trauma, but I think right now, and I've started to talk about it both in hearings as well as in broadly in the public, is primary trauma. I think our staff are experiencing primary trauma from sitting with children being assaulted in offices. I've said that in a previous hearing. Primary trauma is different from secondary trauma and vicarious trauma. But being able to share that and express that and recover and have that treated is very important, because compounding over time, that trauma becomes complex. And you have to have some relief for that. And so in my previous job as the CEO at End Slavery Tennessee, for instance, those individuals that we had on the direct care side, we required to have therapy once a month, and we paid for it. And we encouraged them to take mental health days. I realize that in the state we have EAP, and we encourage employees to go to EAP and utilize the state system for that. But in order to supplement that, we have peer counseling, we have peer support, we have crisis debriefing, and we're also exploring a couple of other things. I would like to, and this is something we did at TBI while I was at TBI, is we had a group of trained chaplains that we had regionally when we had crisis events. Obviously, law enforcement goes through a number of traumatic events, and people relate to counseling and trauma in different ways. And some people want traditional therapy. Some people rely on clergy and chaplain, and that's what takes them over, gets them over the hump. And so we want to be able to offer our employees what they need in order to recover and feel good about their job. And so we're working on meeting the needs of our employees, either through mental health days, EAP, peer counseling, and something new that I'd like to bring forward in 2023, which is specially trained chaplain services in each of the regions of the state.
Follow up.
You're recognized.
Thank you. Thank you for that answer. And, I'm going to come back to this later, but I just want to maybe plant a seed right now by asking a question. One of the things that was really made an impact on me was talking to the audit team about their experience in the field and visiting the field offices. And when we talk about the emotional well-being of these case managers, what does it do for them when, say, in Clarksville, Tennessee, they've got kind of a house full of kids, so to speak, and they're trying to get laundry done, they're trying to meet the needs of all these children. What does it do for them when a local church or a local civic group shows up and says, how can we help? What does that do for the emotional well-being and the morale of our caseworkers when that happens?
It's tremendous. I met about 6 weeks ago with the governor's new faith-based and community initiatives director, Lance Villio, and he said, what can I do for you? And I said, you can do two things for me. One, you can get me 1,000 new foster families. Mm-hmm. And two, you can start delivering hot meals to offices in transitional homes. And in the first month, he delivered 500 hot meals to offices. Andy and I, the chief of staff, in between a lot of hearings here at in Cordell Hall, we went on a sweep of West Tennessee and toured a lot of offices, and we talked to a lot of frontline case managers and listened to them vent a lot about what their needs were. And one of them was, we can't even get hot meals for kids. And so I said, Lance, we need hot meals for kids. And so in the first month, the churches have delivered 500 hot meals into offices. Because if I know anything, it's that the church ladies can deliver hot meals. Mm-hmm. And so the faith-based community will deliver, you just have to ask. Mm-hmm. And so I think we've got folks out there who will deliver that kind of service, Chairman, if we ask. It's just about getting the ask out there. I think you're exactly right.
Thank you. And I'm going to come back to that later, but the point that I'm going to go ahead and make now, and I'll reiterate later, is that it's there's a lot of people that are upset about what's going on with DCS, but it's so important for people to understand that to solve the problem, we can't just look at you and put you on the hot seat. People can't just look at us and say, what are you doing about this from legislative oversight, or look at the governor and say, Governor, what are you doing about it? This is a problem that's going to be solved by Tennesseans. And it's going to be solved because we all say, how can we help? And I think each one of us is going to have to go through this evaluation of what are we doing from a charitable standpoint to serve our fellow Tennessean. And I think I know when I look in the mirror, I right away I think I could do more. You know, there's more I could do. And later on in the presentation today, and I'm going to warn you, I'm going to ask you to list the cities where these 12 offices are, so that we can issue a challenge to the people in those communities to discover where this office is and see what they can do to help. Because we've gone through this year after year after year, and what has to be different this year is that we need the 7 million Tennesseans to see that you've got a group of people whose hearts are for these children, and they're working hard to serve these children, and they do need someone to show up and say, can I do laundry? Can I bring a hot meal? Can I supply you with anything you may need? And you know what? All the programs that we can do from a government standpoint, all the funding that we can put into it, it would be difficult probably to match the impact of just that simple act of kindness to a caseworker who is struggling with a handful of kids that, and it's been a long day. So I'll come back to that later, but I want to plant that seed now, and thank you for the answer to the question. Thank you, Madam Chair.
Thank you. Any other questions? And we'll save public comments for the end of all of the different questions here. So now we will proceed with the auditors on items. Now, 4 and 5 both relate to placement. I don't know if you all had planned to combine those. Very good. Thank you.
My name is Lindsay Satterman, and I'm a Legislative Audit Manager with the Comptroller of the Treasury. Our next topic is child placement, and we will present Finding 4 and Finding 5 together. When a child enters DCS custody, case managers must find the appropriate placement that will provide the care the child needs. These placements include foster homes, treatment facilities, and secure residential facilities. See Finding 4 on page 34 of the report. Tennessee faces a crisis-level shortage of long-term placement options to meet every child's needs, which has increased the number of children staying in temporary settings such as state office buildings and transitional houses. Over the last 4 years, DCS has seen a 7% increase in the number of children coming into custody. In 2021, DCS did not meet their foster home recruitment goals, and foster home closures outpaced foster home approvals. In our survey of case managers across the state, case managers said a challenge they are facing is finding long-term placements for children, especially those with a higher level of need. DCS also lacks placements for delinquent children because the juvenile detention centers are 100% filled. When case managers can't locate an available and willing placement, the child must stay overnight in temporary placements, while case managers continue to search for an available placement. Case managers must make phone calls, send emails, or text to find a placement. On the screen, you will see an example of a case manager in the Mid-Cumberland region contacting all 49 foster families in one county of their region, trying to find a placement for a male teenager. In this instance, there was nowhere for this teenager to go, and he stayed in a temporary setting. The case manager repeats this process every day until a placement is found. Because DCS's case management system, TFAX, does not have the functionality to track or search for placement options, case managers must use various spreadsheets. In April of 2022, the previous commissioner started requiring the regions to report every day the children staying in a temporary placement. Based on our analysis of this information for a 4-month period, there were 322 children that stayed overnight in the office building for a combined total of 205 days, or stayed in a transitional house for a combined total of 156 days. Finding 5 on page 38 of the report is about children who stay in transitional homes or state office buildings that have inconsistent experiences in terms of the quality of the facility. During our audit, we visited 4 office buildings and 2 transitional houses where children may stay overnight. Staff explained that they are often supported by community partners, so the available supplies such as food and clothing vary by location. Case managers caring for children ensure that they are fed and have a place to sleep and shower, but they cannot always do everything at the same place. Also, management did not implement formal guidance addressing transitional houses until July of 2022. While this new July 2022 protocol addresses how staff can use transitional houses and how to supervise children staying in them, it does not address the department's expectations for supplies and amenities in these temporary settings. Management concurred with both of these findings, and this concludes my presentation on findings 4 and 5.
Thank you very much. And now, if the agency would respond. Thank you.
Commissioner Margie Quinn, Chief of Staff Andy Varinsky, and Audit Director John Murphy. On finding 4, during the pandemic, that obviously resulted in foster parents refusing placement and a number of houses closing. The level of behavioral and mental health needs of children and youth entering custody during and post-pandemic exceeded the caretaker skills for foster homes, resulting in the higher number of refusals to accept placement. Stressors within the provider network resulted in the network's inability to accept many of the children's youth needing higher levels of care. In my budget hearing, I spoke about the fact that we don't have a bed shortage, we have a funding shortage. We have a system that was built for the needs of the children that we saw 10 or 15 years ago. We don't have a system that's built for the needs of the children that we see today. We are building a network and a system for the needs of the children that we are serving today. That is a transformation. We are in a transformational period right now. Our action steps are contracting with private providers for foster parent recruitment and certification in partnership with DCS regions. Coordination with the Governor's Office of Faith-Based and Community Initiatives to recruit and support foster families. We've scheduled a meeting with a nationally based provider recruitment of foster homes during the first quarter of 2023. We have a budgetary request for $30.8 million for provider rate increase, and that will increase our continuum of care and get the rates where we need them so that we can compete both with out-of-state kids coming in to utilize the beds in our state, as well as private pay. The budgetary request includes $2.1 million for rate increases and bonuses for foster parents. The bonuses are targeted on placement of teenagers and large sibling groups. Teenagers are extraordinarily difficult to place and make up the vast majority of the children who are in our offices and transitional homes. The budgetary request for $33.4 million for rate increases and bonuses for residential providers, and these bonuses are targeted to stabilize the length of placement. These will also, we hope, incentivize providers to not disrupt placements when children become disruptive in placements. The risk mitigation is the creation of foster care assessment homes within the provider network. These assessment homes will allow children to get the great care while we assess their current needs. Expand the DCS DIDD provider network for children with higher and specialized needs. An enhanced protocol of DCS foster parent support needs to prevent foster care disruptions. We need to support foster parents who are willing to take higher needs kids. On the output side, revision of foster home closure policy targeting previous closures due to no placements. So we want to lengthen the amount of time that foster homes can remain open if they are not taking placements. Heretofore, we were closing them if they did not take a placement in 6 months, and we want to lengthen that so that we can keep these foster homes open. Things happen. People go through hardships. People get sick. And we want to make sure that our rules are not preventing homes from staying open when people go through hardships. And so we're revising our policies to keep some of these homes open. Finding 5, pandemic again resulted in the many foster parents refusing placements. On our action steps here, in addition to steps in finding 4, we are revising the protocol for transition homes. We have a memorandum of understanding that we've established with each home. In the initial network, we had 4 Isaiah 117 homes. We have expanded the MOU to allow a longer than 72-hour stay in the Isaiah 117 homes. We have an expansion. We now have 25 transitional homes and 7 additional pending approval. There's a budgetary request of $8.7 million for assessment placement homes to evaluate the needs of children. We have a revised protocol for transitional homes, which will be updated in January of 2023. And again, that's about, to the comptroller's point, of providing equity of services and equity of services and amenities. Thank you, Lindsay. Equity of amenities within those placements. And we have partnered with faith-based community agency Isaiah 117. If you will flip to the next page, you will see the statewide transitional house locations. The red star is the existing transitional house locations. The blue star are the transitional house that are in the planning stages. And then the blue pluses are the areas of potential expansion. So we need them in Shelby, upper northwest, southwest, south central, and upper Cumberland. So you can see where we've got our transitional homes. And obviously those are preferable to office placements because those are traditional home settings. I will tell you that there has been, I think, great progress in this particular area. Over the last 30 days, Network Development has placed 97 children. 97 children. This is amazing progress. The provider network is opening up. We've been meeting with providers. They have seen our budget request. We have streamlined our process internally. The placement of 97 children is extraordinary in the last 30 days. The Knoxville office has not had children overnight and on weekends in the last couple of weeks. This is extraordinary progress. I know that that's only a couple of weeks, but given what we've been through in the last year and a half, it's progress, and I'm sure it feels like progress to those caseworkers up there. So it is movement in the right direction. I look forward to your questions.
Chairman Roberts, you're recognized.
Thank you. On our transitional houses, and if you said this, forgive me, I didn't catch it. On average, how many children can they accommodate? And is it, and I don't know what the restriction is on how many, I don't know how that's determined, how many kids can be in a transitional home.
Depends on the size of the house, but it ranges from 1 to 12.
Okay. Do we have an average? Would we? I'm sorry, I've got you unprepared with that question.
The average would be around 5.
Okay. Thank you. Thank you.
Representative Dixie, you're welcome. Your mic.
Sorry, I just started talking. I see the picture up there with the offices, and I'm assuming that's where some of the kids go when they're taken to an office for overnight or a weekend. I guess so. My question is that, we have the holidays coming up,
At the end.
Christmas and New Year's. What are we doing immediately to try to address those kids' needs to try to keep them from living in conditions like that throughout the holidays? And I'll state that because if we are removing kids from homes that have conditions like that and we're putting them into that same condition, so they're already traumatized and you put them into another traumatic situation, how is it making it better for the kids?
I would say that the conditions from this picture have improved pretty significantly. We're attempting to get all children out of offices at this point. We have a pretty aggressive goal, which I really hate to say in front of a whole lot of news media back here. But we need to get all kids out of offices and into transitional homes and cottages, and we're working very aggressively in that direction, partnering with DIDD and other state agencies to look for cottage locations that have beds and showers and bedrooms and living rooms. And if we're going to have to take kids out of homes, we need to put them in homes. If we can't get them in placement immediately, then they at least need to be in homes. That would be the goal. And I agree with you completely.
And this is just a kind of along the same lines, but a little different. And that with the shortage, it's a combination of what we've already talked about and this too as well, is dealing with runaways that we have. Like I think in Davidson County, we've had like over 40 over this past year. I guess my question is like, how are we preventing that from happening? Then how many has been located? I think if it was 40 over the past year, how many has been located? Are we keeping record? Are we keeping track of that?
We are keeping track of that. We do report that. We report that to law enforcement. That's obviously a problem. I will tell you that in my previous career in law enforcement, spent 11 years as the statewide Amber Alert Coordinator. I was also over the Missing Children's Clearinghouse for the state for 11 years. I take very seriously the issue of missing children. Nothing good happens when children are missing or in a missing status. DCS is partnering with the TBI on a quarterly basis to go out and very aggressively try to find these children. Depending on what jurisdiction you're talking about, police departments, especially the Metro Nashville Police Department, has a very aggressive youth services division. We are working very closely with the youth services division in Metro, for instance, to look for these children. Unfortunately, a lot of these children who are in a missing status are at very high risk for trafficking. And DCS is going to roll out a very aggressive trafficking initiative in January, again, partnering with TBI as well. And so these are all issues that we're going to create policy and protocol around and be very proactive and very aggressive about in the new year.
All right, just quick. So we don't really have a follow-up number of how many have been found or located or...
I can get that. I will get that to you.
And then my last question is, I kind of want to reiterate what my colleague from Anderson County asked earlier. So are there any plans to bring legislation to help fix the caseload, which could also, like a chicken and the egg type thing? We've talked about that. Where do you start? We got to start somewhere. So are there any plans to bring any legislation to us so that we can work together to try to help fix this caseload issue?
I think I don't know of any legislation. I suspect there will be legislation. And obviously, we will work with the legislature on any legislation that comes forward.
I think that just want to make sure that we're clear. You don't have to wait on us. You're the expert. You're the boots on the ground. We need your input to help us create good legislation. And if I'm not mistaken, that was the point that my colleague
Okay.
wanted to make. So I think that, becomes that teamwork that we talked about
Right.
earlier. So let's truly make it a team.
Yes, sir. I'm hearing you.
Right.
Thank you.
Representative Littleton, you're recognized.
Thank you, Madam Chairman, and thank you guys for being here today, the auditors as well. So this has been an eye-opener for all of us. I think we kind of saw some of it coming, but not to the extent of what this audit is. And thank you for being here and working with us. And I do want to address the capping. We all want the caseworkers to be capped. But what happens when, like the situation that we're in now, if we cap it, what do we do? We're not here as legislators to change the policy, so I think we need to be really careful with capping at this point, the caseworkers' loads at this point. I really like the 10 for the beginners, caseworkers, the beginning. I think that's a great cap, and I think that's well presented and certainly well needed. I want to say, too, that caseworkers are very special people, and so are foster parents. So when we talk about the caseworkers and feeding them and the children, we need to help the foster parents as well when sometimes they get overloaded. And a lot of times it's a nice little surprise for them to get 3 or 4 children at 10, 11 o'clock at night. So, and I think the churches really step in and help them, and I think that's well needed. I know that I can never be a foster parent because I'm never home, but I know there are a lot of us that maybe could be, or maybe that's how we help the caseworkers and the foster parents, is to be there for them and help them as we go along. I also think that prevention, we talked about that. Prevention is where we have to start, is preventing these children from becoming teenagers where no one wants them. Because after they've gone through so much as a child and then they're moved around as teenagers, they're unruly and they're very hard to place. And once they're placed, it's hard to keep them there because they have become unruly because they've been moved around so much. So I think we need to take that into consideration as well. But I think prevention is where we have to start. I mean, I've said that all along, and I think we need to really capture by 5 years old and get those children the help and the needs that to keep them properly taken care of. So I think there's a lot to look at here. We didn't get here overnight, and we're not going to fix it overnight, but we're working, and it's a good place to start. And this audit has really helped us, opened our eyes, and we know where to go, where we need to go, and how we get there is going to be up to all of us to consider how we do this. But I'm going to say one more time, I think prevention is the main thing that we need to focus on, so that we don't have teenagers sleeping in offices, and we don't have teenagers that no one seems to want. So there's still loving children that someone needs to, they need some love and care, and it's hard to find that for them when they really don't, they can't accept it at this point. So anyway, those are just what I needed to say about these things today. Thank you.
Senator Wiley, you're recognized.
Thank you, Madam Chair. Commissioner, let me ask just a couple of questions, if I might. The transitional houses and homes, I think are going to be an important element to our, response, at least on a temporary basis. And I'll tell you why I say that. Having had the opportunity to work with other states on their child welfare system, systems can come to over-rely on transitional homes so that they become nothing but a temporary parking space, much like an overnight at an office can be, if we're not in the transitional homes, making them assessment homes, getting evaluations done, and quickly having placement and treatment services for kids. Otherwise, we're just kind of pushing them into another stop. So I think that's something we're going to have to be very mindful of, is transitional homes are not a long-term answer to what I think the demands are. It's the recruitment and retention of foster placements and adoptive placements and such for permanency attainment. So I think we see things in the same way, but I do think, just as you're talking about the 2-year temporary private case management engagement, we need to be looking at transitional homes as something really for short-term remedy as we look for, really what long-term best outcomes are, because transitional homes aren't. One other inquiry I have is we try to build up capacity for placement and treatment of kids. I know one of the things you've mentioned are the rate increases to providers, something that I think we talked about in another committee that Chair Lady Littleton and I have been working with you on, has to do with Tennessee's history of purchasing beds, but they have to be filled in order for us to pay for them. And then us wondering where is their capacity when we need capacity, when just as you mentioned, the providers are going to be filling their beds because they have to make margin, no margin, no mission in this private sector world with which we partner. So could you comment a little bit on that and where we can go to maybe really securing, obtaining increased capacity from our current providers?
I've talked with the providers about all of those scenarios. I think they're very hesitant to let us buy open beds because other states and private pay are still paying higher rates. And so even if we're paying increased rates and paying for open beds, they're still losing money. They can still rent that bed, if you will, to another state or private pay and make more money than they would if they were giving us the bed, so to speak. And there's still going to be a lag time between when a court brings a child into custody and the placement occurs. There still needs to be some assessment of that child and what that child's needs are, whether that child needs a level 3 placement, a level 4 placement. And so when we talk about assessment homes or assessment placement, so that a CANS assessment can occur, a CFTM can occur, it's important that we fully assess what that child's needs are so that we make the best first placement. So the child's not going into placement and back, and into placement and back, and into placement and back. I know we've all read horror stories where a child goes in and out and in and out and in and out. And what we're trying to do is take a little bit of time, whether that's 7 days or 10 days or 14 days, where a child's in a really good placement, where they're getting great care, getting their educational needs met, their psychiatric needs met, their medical needs met, their physical needs met, and we can do a great assessment so that we can do the best first placement. That's very important, that we do a great first placement so that a child's not going in and out and in and out and in and out and in and out. And so it takes a certain amount of time to do a CANS assessment, up to 14 days to do a great CANS assessment. And then a CFTM needs to occur. And then we can really do a great first placement, whether that's a specialized foster placement, whether that's a level 3 a level 3 placement into a residential facility, level 4 placement into a facility. But these assessment homes or a specialized foster placement assessment home, again, we've got to have options within our placement network, whether that's foster or residential, so that we can do an assessment for that first great placement. And that's what we're working towards.
Thank you. And I certainly agree that the challenge becomes, though, when, as you say, there's supposed to be a limited time for the child to come and get an assessment done for that first great placement, but the first great placement's not as easily available, and so we can over-rely on these transitional homes because at least they're there, and 14 days becomes 30, becomes 60. So that's my only, word of caution to all of us, is that we need to use this as another tool, but need to be mindful that it's supposed to be time-limited assessment to refer on to services. Thank you.
Thank you. Chairman Roberts, you're recognized.
Thank you. I want to follow up on Senator Wally's comments about transitional houses. Two questions. One is, how long does it take for a transitional house to come online? And what is the process that they have to go through to be approved? Just not in great detail, but in other words, we have a need for additional transitional homes, but I have no idea what it takes to certify somebody as a transitional home. I have no idea how long it takes. And I'm asking this question really for the public record because I want the public who's listening, the media who's reporting, to be able to help spread the word that we need transitional homes, and here's what it takes to have one, and I'll have a follow-up comment after our answer here. Thank you.
This is Sandra Wilson, our Deputy Commissioner over Child Programs, and you have asked a question beyond my
okay.
knowledge.
You've got somebody to answer it.
In
That's
the first
good.
100 days, I'm
yeah.
going to let Deputy Commissioner Wilson answer
Thank
this
you.
question for you.
And I'm happy to respond to that because
Excuse me, and please, for the record, just identify yourself. I know they told us, but just identify yourself and check that mic every time. Thank you.
Sandra Wilson, Deputy Commissioner of Child Programs within DCS. And it's a great question because she previously spoke to community ownership.
Excuse me 1 minute. Would you please pull the mic?
It just needs
maybe
to be pulled closer.
Pull
Yeah.
closer. You have
Is
a
that
soft
better?
voice. That's much better. Thank you.
Everyone reminds me that I speak too softly, sorry. In terms of community engagement and ownership of the issues that DCS faces, this is an arena where the community has strongly stepped forward to support us in finding alternatives to permanent placements. With the exception of 2 of the transitional houses, all are community and/or faith-based, and those entities have come forward to regional leadership and offered to support the department through finding alternatives for kids that we don't have immediate placements for. So specifically to your question, for the most part, communities have reached out to our regional leadership and asked how they could support through alternative arrangements. They've borne the burden of the expenses incumbent with either renovating existing facilities, erecting facilities, or taking facilities that were already ready that were underutilized. For example, in Montgomery County, a church that was on the church premises that required little renovation, they offered. The department has no expense related to any of these facilities other than ensuring that the kids have food, appropriate clothing, and access to normal amenities such as showers, etc. In many instances, the facility owners, the community partners provide the food, they do the laundry for our staff, and so it's an arrangement where community has stepped forward to meet this need.
Follow. How long of a process or what, I don't know if there's licensure involved here or what kind of approval, somebody says they want to do this, what does it take to prepare and present a home that's available for children?
The time frame varies depending upon what's needed to get that home or cottage ready. It's not a licensure process. The arrangement is through a memorandum of understanding that's handled by our legal office. And the time frames have varied. Most Isaiah houses erect new facilities, so that obviously could take longer. But many of the other resources are existing facilities that simply need to be renovated or updated slightly. So it could be as little as 2 to 3 months. It could be as long as a year or so.
If somebody was interested in providing transitional housing, is there a resource available online, or would they just simply call the office, or how would they make contact?
Heretofore, they've simply contacted regional leadership offices and made the offer or inquiry in terms of whether or not there was a need. What we typically do is to provide the demographics related to the need. We don't try to persuade, we don't try to dissuade. We make available what the demographics of that location are, what the need is, and then those partners make the decisions relative to whether or not they wish to proceed.
All right, then I'm going to do your persuading for you, and I'm going to make a statement right now. You know, we've got media in the back. The media did a great job of calling attention to the problems. I want the media to call attention to some of the solutions. And right now, when I look at your map, I see 4 obvious holes. I see Trenton and Gibson County. I see the triangle of Linden, Waynesboro, and Hohenwald. And I see Cookeville, Tennessee, and I see Memphis, Tennessee. And so what I want to do is I want to persuade our churches and our community organizations in those 4 areas, Memphis, Trenton, Waynesboro, Linden, and Hohenwald, and Cookeville. Of all places, we've got more churches in Cookeville than probably any other county in Tennessee. I want to, issue the challenge for these areas. We don't have anything in the Upper Cumberland. You've just got a big hole on the map with a plus sign saying that you need some help here. And I want to issue a challenge to the churches and faith-based organizations in these 4 areas to reach out to DCS and ask what your needs are and how can we help. Because what I'm hearing you say is that if somebody's motivated, this need can be met fairly quickly, and children are not going to have to spend the night in offices. So I think this is a great opportunity for Tennesseans to step up, be the volunteer state, and help solve a problem, and is going to be repeated, at least by me, and that is this is a problem that all of us have to work together to solve. And I see this as a step that can be taken. And to Senator Wally's point, no, we don't want people to incorrectly use the transitional housing as a permanent housing. But I suspect, Senator Wally, if it's a large church that does this, that maybe some members would see the need for foster families, and maybe if you've got a church of 1,000 or 2,500 people, maybe some of those people would be motivated to go one step further and become a foster parent. So I see that also as a great opportunity to not only bring a child into transitional housing, excuse me, but then maybe also be able to provide a home for them to stay beyond that. So I want to issue that challenge. I'm doing it for you. And hopefully the media will respond to that, because they've done a great job in calling attention to the problem. Now what we need is their help in calling attention to the solutions.
Thank
Thank you, Madam Chair.
Thank you, Chairman. And Representative Chairman Reagan, you're recognized.
Thank you, Madam Chair. My question is similarly oriented to these previous 2 colleagues of mine. Do you maintain statistics on your transitional house volume use by rate, by you mentioned age category, also by criteria that you require, as in proximity to schools or so forth, and what the success rate of various setups are? On the map here, I've counted, I think, 4 Isaiah House and Emmanuel House and some churches on here. Are these more successful for you than perhaps others, or are there criteria that you look for that is indeed a better match?
Again, in terms of...
Excuse me, just re-identify yourself. Thank you, ma'am.
Sorry. Sandra Wilson, Department of Children's Services. In terms of utilization of the various transitional houses, it's more about proximity to where the kid is, where they come into custody, the location they disrupt in, and where the need is. All kids who are of school age, who are placed in transitional houses, are transported back and forth to school daily. So proximity to their school location is appropriate. The other factor has to do simply with the volume of need. Sometimes our local staff have to make the decision to cross regional lines to utilize a transitional house because there's not capacity or a location in their region that's immediately available.
You're recognized.
Let me make my clearer there. You've given me a generalized answer, which is fine, except like I said, you have several different varieties here, both churches and others. Are are any of these more successful than others in terms of satisfying your needs? That's basically what I'm asking.
Essentially, I'm sorry, Sandra Wilson, Department of Children's Services. Essentially, they're all successful, or we wouldn't continue to utilize them. They all meet the basic needs of the children we serve. As the auditor has pointed out, some of them have a higher level of amenities, but most of those amenities are directly related to what the department requires, such as how are they meeting the food needs? How are they meeting the sleeping arrangements? We essentially don't have facilities that rely on mattresses, air mattresses, etc. We would require that they have beds. If you have an unexpected influx of kids at a given location, such as we had about a month or so ago, we did have to rely on a couple of air mattresses. But the amenities and the makeup of all of them are required to meet the basic needs. So I would not say that any of them are more successful than others.
Thank you.
Thank you. And now, Representative Crawford, you are recognized.
Thank you, Madam Chair Lady. And I guess this is kind of going to Senator Roberts and Chairman Reagan's same questions, but I am from Northeast Tennessee, which is Sullivan County, and we have an Isaiah House there, and we were talking about faith-based organizations and churches and those type things. If I'm not mistaken, that particular ideal stemmed with one person and the needs in our community, and from that we have had several different areas that have been provided an Isaiah House and are truly making a difference within those communities. And we have several more that are in the planning stage that hopefully we will see this trend continue further west. But that being said, the communities have really taken hold to this. They've provided really good services. And if I'm not mistaken, the communities have helped so much that this organization here does not take any state funding that I'm aware of. They're doing it all through the communities. And that is us Tennesseans stepping up to do what's right. And with your encouragement, I would like to also say this isn't about a certain amount of people. It's not about one person. This is about what's doing best for Tennesseans. And we as legislators are here to work for you guys. We work for the state. And any encouragement we can do, anything we can do to make it better, that's our job. And hopefully we will continue, now that we've identified some of the problems, to be able to fix those, whether that's legislatively or whether it's other ways. We're very thankful, and we say this all the time to the comptroller's office and the audits that they do, but it's hard to fix problems when you don't know where the problems is or what the problems is. And so thank you all very much on your diligence. Thank you, Commissioner, for standing up and taking a stand and trying to fix these things. We truly appreciate it. Thank you.
Representative Dixie, you're recognized.
All right, thank you. This question is for Commissioner Wilson, correct? Right. All right, you had mentioned about these transitional houses. What level of training does DCS provide for them, and what's the involvement in those houses, other than just bringing them online and providing food and things of that nature?
Sandra Wilson, Department of Children's Services. And the department currently offers training to any volunteers who work with any of the facilities. I need to first say that our staff have to have a level of presence in every one of them at any time we have children placed there. So our staff are directly responsible for the supervision. But we also utilize volunteers. Isaiah Houses rely heavily on volunteers who have been trained in trauma-focused practice and who are certified under Tennessee's volunteer requirements. We also use sitter services, as the Commissioner has mentioned. We have a very abbreviated sitter service package. All of those individuals go through the necessary background checks before they are allowed to sit together with our staff to help supervise our kids.
And lastly, it seems like there's a push to kind of shift the focus on the community to take responsibility, privatization, and I'm assuming that if we have money to pay for privatization, then we should have money to increase the salaries for everyone. I don't know what the salaries will be for the privatizations, and maybe you can speak to that later, but it seems like here in Tennessee, Tennesseans are struggling. Average Tennessee is struggling to meet their daily needs, like pay bills, keep a roof over their head, food on the table. And we're going to ask these same people to take away from their budgets, their limited budgets, to try to help out. Yes, that's something that we should be doing as people, but at the end of the day, Tennessee has billions of dollars in reserves. And we're going to rely on that struggling Tennessean to fill in these gaps. Isn't that the role of the government, to take care of its citizens and constituents? Shouldn't we be playing more of a role instead of relying on the community to fill in those gaps? I think that's a nice addition too, but it's not. It should not be the entree. It's a nice side, but we as the government need to supply the needs for these children and these families. And you can respond. It may be more of a statement.
Excuse me, Commissioner, could I answer that question? And then you may obviously supplement my deficiency, but in response to that, Representative Dixie, one of the Isaiah houses was started by a small group in Grundy County, and it came with a lady from Sullivan County. And my husband and I were invited to the dinner where we were going to discuss whether we should raise the money to help with this Isaiah house. And I went there with the attitude that you're expressing, Representative Dixie. The state has billions of dollars. The state needs to be doing its business. The state needs to be doing that. Why are we going, and Grundy County is one of the 10 poorest in the nation. Why are we going to be doing this when the state, if they take a child from their home, they should have a place to take it that is safe and secure and provides for all the obvious needs of a child? Unfortunately, what is happening in our state with this number of children growing is that we have failed, maybe in our churches, in our homes, in our communities, to encourage healthy families, to help families in the preventive mode that you're thinking. But when you come to the fact that regardless of how we got to where we are where we are. And so I went to the meeting, I told my husband, now we're here to listen and we'll be nice, but I don't think we should offer any money because the state needs to do this. And so we went, and I'll keep from crying, but we had the presentation. And we had the presentation from a mother who had kept foster children. And when you learn the tragedies that these children are going through, and what a small amount in comparison to a lot of things that we're being asked to provide, the Bible in Isaiah 1:17, learn to do good, seek justice, rebuke the oppressor, defend the fatherless, plead for the widow. These are things that we can do. And so when my husband said, well, what do you want me to give now? What are we going to do? I said, as much as we can afford. Because the need was a relatively easy one. And within a year, Grundy County led the charge to build an Isaiah house according to the specifications, because these aren't just any old house. They have specifications with the rooms, the bedrooms, and it's a home. But more importantly, you then get local people to be volunteers to come in with those children, and they're sitters with the state. But at the same time, that is increasing the need systemically within those counties of the need for foster homes, because this builds that personal relationship with some of the children. And our society has changed. We're more transitional now. And so there was a time when if a family was having a hardship, neighbors, the church, everybody knew what was going on, and they stepped up and stepped in, and just like the barn raisings and the roofings and things that people did. But now the Isaiah House, because we aren't as interconnected perhaps with these families that need this assistance. So if you don't mind, my answer to your question is go to one of the meetings where they're asking for money for the Isaiah House, and it will change your mind and your heart. Because I was right where you are, and I recognize that, no, God calls us to a higher calling, to help the widows and the orphans and the children. And in obedience, the house is wonderful. Many people are now involved that would not have been otherwise. And that is why people in Tennessee need to help hurting families in Tennessee. You may answer now.
Thank you. I respectfully, I understand your question, which is why I asked for just shy of $160 million to assist the department in getting on the right track. I do also think that the state makes a poor parent, and government is not always the right answer. I've always believed in a public-private partnership, and I believe that DCS has always relied on community stakeholders and partnerships with communities and nonprofits. And we do well when we're working with our partners in local communities. It's how we serve children and families the best. And so I understand exactly where you're coming from, and it will be a matter, obviously, for the legislature to determine how much they want to appropriate to the Department of Children's Services. But we have made our ask, and we will continue to do the business to serve the children and families of Tennessee.
I think that somewhere along...
You're recognized. One more question.
Sorry. I think somewhere along my question, it went left somewhere, because I don't think nobody understands what I'm saying here. My question is not saying that we don't have community involvement. Mm-hmm. I think the state needs to provide more to those community resources and those programs in order to them to operate effectively, because we've all been in organizations where we volunteer, and we volunteer when it's convenient for us, mm-hmm. not when it's easy for us. So my question was, how can the government, as I've always said, we need to be a team, provide more resources to make sure those Isaiah houses, the Dismas houses, all of these mm-hmm. particular programs and organizations can survive and not rely on the average Tennesseans, because our company goes up and down. Yes, we're doing well right now, but it could be a downturn, mm-hmm. just like when we had the pandemic and you had a lower supply of housing in places. So my question, well, not my question, my statement, I just wanted to make sure we're clear here. The state needs to play a more important role in facilitating those public-private partnerships, and we can do that with more funding to the organizations who are helping do this. Thank you.
And Dismas is a great example.
And in the interest of time, we're going to proceed with the auditor, and then Senator Wally had wanted to be recognized, and you can be recognized after this presentation, if you don't mind, and speak to maybe more of a summation. But if the comptroller's office would proceed, thank you.
Sonia Perry, Legislative Audit Manager, Comptroller's Office. We've talked about how the most important responsibility of DCS is to keep children safe from harm. And so DCS operates the Child Abuse Hotline, where anyone can report suspected child abuse and neglect 7 days a week, 24 hours a day. And from February 2021 through July 2022, DCS received over 200,000 allegations of suspected child abuse and neglect. The department has several groups within itself to respond to these allegations, which include Child Protective Services, Special Investigations Unit, and a unit known as the Prison Rape Elimination Act Group. Findings 6, 7, and 8 all deal with how the department responds to these allegations, and we plan to present them separately. However, if we need to present them combined, we can
Please.
as well. Okay. Finding 6 is a repeat finding, and this finding is about how management continues to have delay in moving Child Protective Services investigations through the investigative process. We found that in our file review, 4% of the time contact with the child victim was not timely, and then 40% of the time the safety assessment piece was not performed in a timely manner. We feel like these key steps in the investigation process will keep children from remaining in potential abusive situations. Finding 7 is on page 50 of the report, and finding 7 deals with the department did not ensure that reported allegations of sexual abuse, sexual harassment, or lack of supervision for children in residential facilities were investigated. Residential facilities include treatment facilities and also the juvenile justice facilities. Sexual abuse or sexual harassment allegations occurred in residential facilities are referred to that PREA group that I mentioned, and if the facility is primarily housing 50% juvenile delinquents. If the facility does not house 50% juvenile delinquents, then PREA group does not investigate those allegations. We found that for 34 allegations involving sexual abuse and sexual harassment was not investigated because it was not a PREA facility. We also found 37 reports of allegations consensual sexual activity between 13 to 17-year-olds who resided in residential facilities. DCS did not investigate those allegations for lack of supervision for the residential staff. DCS did refer these allegations to law enforcement, but did not follow up to get the outcome of the allegations. We also have a matter for legislative consideration, which is on page 53 of the report. And this is where the General Assembly may wish to clarify in statute whether the department has a responsibility to investigate allegations of non-consensual sexual acts between youths 13 to 17-year-old who reside together in a residential facility. Management partially concurred with finding 7, concurred with finding 6. This concludes my presentation of findings 6 and 7 and the matter for legislative consideration.
Do you want to include finding 8?
I can continue on with
I
finding
think
8.
because it's still very much related.
Okay.
Thank you.
Okay. Sonia Perry, Legislative Audit Manager. Finding 8 is on page 55 of the report, and DCS is responsible for ensuring facilities that primarily house juvenile delinquents comply with the Prison Rape Elimination Act, known as PREA. Finding 8 details the deficiencies in the department's PREA monitoring and investigation process. During the audit, DCS dedicated 2 employees to handle the PREA process. One employee was the statewide PREA coordinator, whose responsibility was to monitor facilities' compliance with PREA. The other employee was responsible for investigating all PREA-related sexual abuse and sexual harassment investigations across the state. If a facility is primarily housing juvenile delinquents, the facility is required to comply with PREA standards. To determine if that facility is required to comply, we found that the department used census data for only 1 day per month and that data was inaccurate. We also found that the statewide PREA coordinator did not monitor all facilities during calendar year 2021. And like the child abuse and neglect investigations, we also noted that there were delays in initiation of PREA investigations and that they were not completed according to the department's timeline. In addition, we found that the department's PREA policies were outdated. They did not align with the current statewide PREA coordinator's responsibilities. They were unclear or they did not align with federal standards. We recommended that the department revise policies, devote additional staff to the PREA process, and adhere to the expected response timeline for allegations of sexual misconduct and sexual harassment. Management concurred with this finding. And this concludes my presentation of finding 8.
Thank you very much.
You're welcome.
And you may respond.
Thank you. Margie Quinn for the Department of Children's Services. For finding 6, I'm going to turn it over to Deputy Commissioner Carla Aaron to talk about the Child Protective Services assessments. That is a very nuanced and kind of in the weeds part of the Child Protective Services performance.
Okay. Thank you. Please identify yourself, and each time you speak, identify yourself, and make sure that mic is as close as you can get it. They don't pick up very well. Thank you.
Yes, ma'am. Carla Aaron, Deputy Commissioner for the Office of Child Safety. I speak louder than the other Deputy Commissioner, I believe. The Special Investigations Unit is a specialized group of folks that we have located across the state to do investigations on our children who are in the residential facilities, as well as daycare investigations and investigations involving foster homes and foster care placements. So they're a little nuanced and a little different in our other than our Child Protective Services investigators. And in saying that, they have a different assessment tool that they utilize, one that was created a few years ago, but it was not incorporated into our TFAX electronic case file system. So it is kept in another system called REDCap, and some of the monitoring with that particular tool is done manually until we can get it located into our TFAX system. So we recognized during this audit that there were several cases where dates were not included when a supervisor approved the assessment tool. Tools were completed, and the process at the time was to put them into REDCap, and then our case managers had to email their supervisor, let them know to go into the system, review it, and approve it. That caused delays. Some of our supervisors were carrying caseloads, so they were not on their email, or they had a delay because of other work tasks that they were doing and going in and making the approvals. So that is what was brought out in the audit finding. We were able to work with Vanderbilt, who manages the REDCap system. They're making tweaks and have been able to extract data for us, and we actually are meeting. We had a meeting late last week with them to tweak the data reports that they're going to be pulling for us. So we should be able to track and monitor not only when an assessment is completed by the case manager, but when the supervisor is able to go in there and complete it. Still not optimal because it's not in our TFAX system, but it is going to be a much better system for us to track and monitor our progress on this particular activity moving forward. We are at about a 70, I think it's 75% compliance rate based on our latest extract from the REDCap system, and we anticipate improving that by about 10% throughout next year.
Thank you very much. Do we have anyone who would like to comment to that? Representative Reagan and then Representative Dixie.
Thank you, Madam Chair. First, 2 systems is obviously inefficient, so the question I have for you is how long do you plan on keeping 2 systems, i.e. REDCap, TFAX, running as 2 systems rather than having a combined system?
I believe someone else may need to answer that question. We have asked for it to be in some of our enhancements in the TFAX system, but I know that is the entire system is going to be reviewed and looked at, and other considerations will be made. So my hope is that we will not have to keep 2 systems, but that is a larger departmental issue.
And while we have another departmental person coming up to share this, TFAC is an audit finding in and of itself.
Yes, ma'am.
Which will come later. And I think that in reading what I've read just at this level, it's obvious that a lot of Tennessee boards and agencies have legacy systems that need to be pitched out the window. And TFAC is one of them. And so you have an inadequate infrastructure supporting a very inefficient and outdated product, which is TFAC. And I certainly don't think it's ideal to have Vanderbilt housing part of our data. Did I understand that correctly?
This is Megan Stacy, our new CIO. She may be able to answer that question.
Okay, Megan, would you like to answer now? Or when we go into TFAC, do you have a presentation that you could make or want to? Or you're welcome to proceed because the question was direct. Why are we using two different systems and it's not adequate?
Introduce yourself.
Hi, Megan Stacy, Chief Information Officer for Department of Children's Services. I am happy to answer that question now. So, as we're aware, and we're going to see later, that we do have some opportunities within TFACS, and it was a finding. I am currently putting together a plan to ensure that we are actually integrating our systems together going forward, but we are trying to take these types of processes and get them into one system currently. This is on my radar so that we can get a better process in place prior to the entire replacement of TFACS, as well as a few others, but I hope that answered your question.
Representative Reagan, you're recognized.
Thank you. I appreciate your effort, but not quite. The question was how long. In your action steps here, you have review and revision of the policy timeframes, Q1 2023.
Yes.
The review and revision piece of this management work, I want to know how long till you've got rubber on the road.
Prior to the replacement of TFACS, while we're still working on that, this will be resolved by Q3 is when it will be done.
I'm sorry, say that again a little. Pull the mic closer, please.
Sorry, Q3 of 2023.
And please identify yourself one more time, just for those that won't see you but will hear you. Go ahead.
Megan Stacy, CIO, DCS. We will have this resolved, the red cap separate system from TFACS, by Q3 2023.
Thank you.
Representative Dixie, you're recognized.
All right, thank you. I was just skipping back, but since I have you here, don't leave for me. And I think I see it in here. My question was, how much is it going to cost to replace this system? And then secondly, was it included in the nearly 160 million that was requested?
It is included in the 160 million, but do we want to save those questions for that TFACS finding? We've got a whole finding on TFACS. Do we want to?
Thank you, and I agree that would be a better process right now, so you can be prepared when we do
We have a
have
whole
that.
finding on it. Okay.
Any other discussion
On
on
6.
6, 7?
Are we going to go to
8.
7?
Yes.
On finding 7, we have a manual tracking process which allowed for delays, and we have investigative activities that were not documented properly and lacked follow-through. We have a specialized, on our action steps, we have specialized training curricula that were developed with external partners that includes TBI training. We have a work group to develop PREA standard operating procedures and updated policies. We have a new SOP that will include investigative and documentation procedures as well as supervisory oversight. We're going to implement a new PREA audit by the Director of Internal Audit. Mr. Murphy is going to conduct a monthly audit for the first 6 months. We have collaborated with the PREA Resource Center federally. We are creating protocols to document PREA tasks. And we are automating the tracking process. Under outputs, under 7, finding 7, we're updating the DCS PREA policy 18.8 within DCS that creates protocols which document follow-up with law enforcement. We have expanded the PREA team, and that's first quarter 2023. The previous team had one statewide PREA coordinator and one PREA investigator. We've had a total personnel change within that team. We have a new statewide PREA coordinator, and we are going to have 6 PREA investigators, which will be 2 in each grand division. One, we're going to update the DCS policy to address child-on-child sexual abuse and associated lack of supervision by caregivers in juvenile justice facilities, and that will take place in Q1 2023. On finding 8, again, the ad here is management did not ensure that juvenile justice facilities were monitored for PREA compliance. And you can refer to the audit report on page 59. You'll see the map there for the juvenile facilities that were not monitored. Under action steps, I would call your attention to the fact that management will ensure that PREA coordinator will set a rhythm of facility inspections for all PREA facilities. Inspections will be conducted quarterly, and inspections will be forwarded up the chain to leadership to ensure compliance. I look forward to your questions.